All right, thank you, Al. So the next item on the agenda is Administrator's Report. Matthew?
Yes, good morning, Supervisors. Just one item, the COVID-19 update with Dr. Willis. I'll turn it over to Dr. Willis.
Good morning, Supervisors. Good morning, community. Today is the 406th day of since we imposed the state of emergency in Marin County for the COVID-19 pandemic response. And we are emerging into a place of cautious optimism as we start to see declines in cases or continued declines in cases and increase in vaccination rates. I'd like to provide an update on our status now. If I could have my slides, please, Al. Next slide, please. This is the numbers so far of over that interval since our first case in early March. We've had 11,572 cases with 177 deaths of Marin County residents. We have vaccinated nearly 145,000 individuals so far. Next, please. And this is a blow up of the latter portion of our epidemic curve that captures the surge in cases we saw in December into January, and then that progressive, rapid decline followed by a more gradual decline that continues today. Next, please. This is our current status regarding patients in the hospital with COVID-19. There are 5 total and 2 in the ICU. Next, please. And this is how those numbers relate to our status within the California Blueprint for a Safer Economy. We are in the orange tier. We are among now the majority of counties in the orange tier. Because our case rates have been in that range between 2 and 4 per 100,000 up until this week. But we have good news that our case rates are declining further, which might open the door for moving into a less restrictive tier. Next slide, please. So it's possible we'll move into the yellow tier next week. Our current adjusted case rate is 1.7 cases per 100,000 cases per day. Per 100,000 residents per day. Because the state has vaccinated more than 40 million doses, we have been able to the state has relaxed the criteria for moving forward. And we are now, the criteria for yellow tier is actually less than 2 cases per 100,000 residents per day for an interval of 2 weeks. So as of today, we have accumulated 1 week. We have 1 week of credit towards that 2 weeks. If next week we also have, continued to have case rates less than 2 per 100,000, we will move into the yellow tier. The earliest would be April 20th. Again, only if our cases do not increase between now and then. Yellow tier regulations will essentially increase capacity for indoor settings and gatherings that are already based on the capacity of the size of the indoor setting, or the code regulations regarding the number who can be indoors safely, moving from 25 to 50% or 50 to 75%, depending on the setting. And it's really across a variety of different sectors. And the best place to see what that will mean for us, because we are following the state regulations and recommendations, is to look at the California Department of Public Health website, covid19.ca.gov. Next, please. So this is our status regarding our vaccination distribution thus far. We have vaccinated 68.3% of our population above age 16 with at least 1 dose, and 44.6% of our population have received complete vaccination, either 1 dose of the Johnson & Johnson or 2 doses of the other 2 formulations. Next slide, please. And this is how that breaks down by age group. We have vaccinated more than half of all in all age groups. We are now near, over 90% of our residents above age 65 have been vaccinated. We have about 75% of our residents age 50 to 64 vaccinated, and about 53% of our residents aged 16 to 49. So that puts us in a good position to be opening our eligibility for vaccines to all residents according to the state blueprint. The state recommendations or the state guidance is that we will open to all residents on Thursday, April 15th. And we are planning to adopt that policy in Marin County this coming Thursday. Next, please. And this is just to keep our eye on vaccine equity. Each week, we look at our numbers to make sure that no communities are being left behind. And this is our distribution of vaccine by race, ethnicity in Marin County, and shows that we have been relatively successful in trying to maintain our vaccine distribution to match the disproportional impact of COVID-19 among communities of color, especially our Hispanic Latinx community. And we'll continue to monitor these numbers. And this is available publicly on the website. Next slide, please. So the majority of this morning has been spent, I've spent in conversations with other health officers and California Department of Public Health, adapting to and having a plan for the CDC's announcement early this morning that the Johnson & Johnson product has been put on hold. The CDC is recommending a pause on its use. They're investigating potential rare blood clot association. There have been almost 7 million doses of the Johnson & Johnson product administered in the United States thus far, with 6 total cases of a blood clot that is an unusual form of blood clot that doesn't respond to the normal type of treatment, which is called heparin. And there's, because out of an abundance of caution, I think as a sign of the sensitivity and responsiveness of the surveillance systems, they've been able to detect that occurrence, although it's so rare that it's less than 1 in a million, and have recommended that we put a pause on the use of this product while they investigate whether or not there's an association with the vaccine itself. In Marin County, Johnson & Johnson is about 2% of doses administered in Marin. We have not had any adverse reactions with that product as it's been administered in any of our healthcare settings, and it's all of our healthcare providers are using that product in some degree. But again, it's been a minority of the products that have been used. For us, it will really primarily, for Marin County Public Health, it will primarily impact our mobile vaccine operations. This is the best product for us when we're out, moving into harder to reach communities, because it's a one and done. We don't have to do a second visit, and because it has been determined to be effective, it's been a really desirable product for us in that setting. We haven't been able to get as much of it as we had hoped. And so it's not having a dramatic impact on our operations because we haven't really been using, again, less than 2% of our total 2 products. So this week, starting today, we're switching our Johnson & Johnson that had been planned for our mobile operations to Pfizer or Moderna. We had not planned any Johnson & Johnson administrations in our mass vaccination sites this week. No additional measures are needed for those who have received the Johnson & Johnson. However, if there are any concerning symptoms, particularly headache, severe abdominal pain, severe headache, severe abdominal pain, leg swelling, or leg pain, those could be signs of a blood clot. And if anyone who's received that product is having those symptoms, they should reach out to their medical provider. Next slide, please. So with the good news of reductions in cases, we're seeing less virus transmission in our community. We are moving closer to the yellow tier. We are seeing dramatic increases or steady increases in our vaccination rates. We have among the most highly vaccinated communities in the state of California and, in fact, potentially the nation. It's important to also recognize that we still have a long way to go. With the success of our vaccine program, if we think about it, children less than age 16 are not eligible to be vaccinated. So that's about 20% of our community that is not eligible to be vaccinated. And then we still have, about 35% of our adults who are eligible who are not vaccinated. So that's about half of our residents remain unvaccinated. So that's plenty of room for outbreaks right there, because we can't rely on the vaccine to protect the community as a whole. So I think if I have any concerns, is that people may see these signs of moving forward in the tiers and high vaccination rates as permission to let down our guard, and we're not ready yet. So what could still go wrong is that mask fatigue and breakdown of non-pharmaceutical interventions, that's physical distancing, covering our face, avoiding indoor gatherings, especially with people who aren't vaccinated. Travel has been a concern for us. We've had multiple cases, clusters of cases associated with travel. We're also concerned about pockets of immunologic inequity that can sustain transmission. So if you think about it, the disease is transmitted from person to person. And so if there are groups of people where the vaccination rates are low, either because we haven't been able to access them or because there's a cultural hesitancy within that group, those groups actually remain a risk for the members of that group and for the community at large. So we're really trying to make sure that we're reaching every community. Obviously, a major concern is also the emergence of more transmissible or less immunologically susceptible variants. In Marin County, we are doing surveillance using whole genome sequencing of about 5% of the cases. We had 15 cases sequenced last week. Among those cases, 2 had the B117 variant, the so-called UK variant, and that was not a surprise to us. But those were the first cases of the B117 variant we had determined in Marin County. We've seen them in other parts of the Bay Area. That variant is presumed to be about 5% of the total cases in the state of California currently. It's characterized by increased infectivity, and that's obviously a concern because it could spread more quickly. And when we talk about the race with the vaccine, I think that's probably the most important factor, is keeping ahead of this particular variant that is spreading much more quickly, especially in the East Coast, and is really now the dominant strain across Europe. Fortunately, the vaccines we now have, all 3 of the vaccines we now have available to us, are effective against that variant. So having nearly 70% of our residents age 16 and above protected now with vaccine, I think sets us up in a better place than many other areas to prevent a forced surge that might be the result of the spread of the B117, but we're watching this carefully. And then I think another potential issue in terms of what could delay our progress further in terms of resolving this pandemic is the reality that this is a global pandemic, and that there has been a disproportionality in terms of access to the vaccine nationally or globally, and that the United States is way ahead of most other countries in terms of access to the vaccine, especially underdeveloped countries, and that until the entire globe has access, every resident, every citizen of the planet has access to the vaccine, we all remain at risk, especially because pockets of unvaccinated individuals end up being at risk for the emergence of new variants. And that's why we need to start to begin to shift our focus towards equity, global equity in our vaccine distribution. Next, please. So in summary, COVID-19 transmission continues to decline in Marin County and across the state. Reopening brings risk and responsibility. Vaccination remains our highest priority, and we're making good progress in our vaccine distribution plan. There are many unknowns regarding the pandemic path. We continue to adapt as conditions change, like this morning's announcement from the CDC regarding Johnson & Johnson. And the next few weeks will be pivotal for us, both in terms of advancing our vaccine distribution and maintaining our focus on those non-pharmaceutical interventions, facial covering, physical distancing, and avoiding indoor gatherings, especially with people who are not vaccinated. Next slide, please. Thank you. And that concludes my presentation.
Thank you, Dr. Willis.